Hello, I'm Hector Garcia. Today I will be performing my IV insertion and discontinue skill today. So the first thing I will do is before I enter the patient's room, I am going to verify the physician's order, verify I have the right patient room and everything before I enter. I have all my supplies. So I will go in there with everything. Here we go. Hello, Mr. Brown. I'm Hector. I'll be your student nurse today. And I'm just here for an IV insertion. Before I get into that, can I just have you verify your full name and date of birth? Brown, 2020. Okay, I am just going to do some hand hygiene here. Like I said, I will be doing IV insertion, and that is just so we could give you fluids if necessary, and push any medication through your IV. So I'll just have all my my equipment ready. I verified the patients. So I am just going to go through my stuff here. Do you have any questions actually? Or are you allergic to? No questions? Okay. Are you allergic to anything? Chlorhexidine? No? Okay. Alright, so I'm going to apply a tourniquet. It is going to pinch a little bit, but just let me know if it's too much. Okay, and I'm just going to palpate for a vein here. Okay, so I do have one good. So I'll just release the tourniquet. I'll leave it there because I will be using it later. Okay, and I'll just prep my equipment over here. I put a Chuck's pad right underneath my area. I have a 22 gauge IV catheter. Needle here that is prepped. Got my tape. I will put on the sticker my 22 gauge, today's date, which is 10/22, and I'll put my signature just to have it prepped there. Just like that. Okay. I want to keep my catheter extension clean, so I will keep it in there, and I'll just apply my saline, making sure that I have at least 3 milliliters of it. Okay, so now that that's prepped, I will wash my hands again.
Are you able to cough for me and move any of those out? Does that help at all? You feel any better?
Nope, I got some stuff.
Hold on, clean gloves.
Okay.
Okay, so since my patient is not allergic to chlorhexidine, I will be using my ChlorPrep here. Okay, break the tube, so get that ready. So I'll clean for 30 seconds, starting in the middle of my area, outward for 30 seconds, let it air dry for another 30 seconds, throw that away, let air dry. I'm going to apply my tourniquet again. Okay, again, you're going to feel a little pinch, so just want to verbalize if the patient was allergic to the chlorhexidine, I would have used alcohol prep pad, but since Mr. Brown is not, we're okay. Is that too tight? No? Okay. Okay, so I got my extension on standby. I will now uncap my needle. Okay, I've already figured out my vein, so I will just prep here with my thumb, bevel up, and insert as close to parallel as I can. Okay, and I will insert, pull my thing out all the way. Okay, and I just stabilize my insertion, cap my needle, throw that in the sharps container, release my tourniquet. I did see returns, so that's why I removed my needle. I am going to now insert my extension. I will also, I will do a return just to make sure that I have some flash, which I do, and then I will insert another 3 milliliters of saline. Okay. Okay, I could remove my gauze or my syringe. I stabilize my insertion site. I will assess for any swelling or any redness. Okay. Put the sticky side down, stabilize. My IV insertion. Okay. Making sure that's clean, and then I'll put another piece of tape to hold the IV along with it, and there's no pull. Okay. And then I'll label my IV site with the sticker that I had already prepped with the needle gauge, my signature, and the date. So I will put that on here. Okay. So what I'll do now is I'll assess the patient's tolerance to the IV insertion. I will document their tolerance or pain, and the IV site, which is their right forearm, and also document the site if there was any swelling or redness. Now that we're gonna discontinue the IV, I would explain to the patient what we're doing. So we're gonna discontinue the IV. Again, sanitize my hands and don clean gloves. Okay, Mr. Brown, I will now remove this sticker and the dressing, and get rid of my tourniquet here.
So I would document
so just to hold, and there's no pull, I'm going to hold it all together now. Remove all this sticky stuff. Hold the insert side in place, and I'll slowly withdraw.
There was one point where it was kind of iffy if you reached too far when you were throwing something in the trash.
Okay. I will assess the site for any redness or any swelling again. I will have my gauze here, folding it 2 by 2. Put it right over there, holding it with pressure for 2 to 3 minutes. Again, I will ask the patient if they have any pain at the moment. As I'm holding it, I am going to put another piece of tape to hold my gauze. Oops.
Do you need to check for an order to clean to do this? Do you need to state that?
I don't think it said.
Or just need to check and have a protocol? Like, I would just say that you're
Okay.
cleaning it to, and I would also do the, clean this trigger.
So after holding on for 2 to 3 minutes, I will then again release, making sure there's not too much excessive release. I will ask the patient their pain. So, are you feeling any pain, Mr. Brown? Anything out of the ordinary? No. So then I'll document all that, and I will clean up my area. So throw my Chuck's pad away. Remove my gloves. This is all trash. Okay. Is there anything else that I could help you with today, Mr. Brown, while I'm here? No? Good. Okay. Thank you.